Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon, creator and founder of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very important and timely topic, and that is what are some facelift trends that I totally support and I stand behind because I believe that they are the next generation, the next level of sophistication that will lead to the absolute desires of all of the patients who seek facial rejuvenation in the first place. So what we're gonna do is we're gonna compare and contrast some of the existing techniques and talk about why the newer techniques or these concepts are really the wave of the future and the ones that we should really look for and set ourselves up for success with. So without further ado, let's break it down. So let's talk about an individual's desire when they seek a facelift. So I've been doing this for a long time, over 17 years. And all that I do is literally do facial rejuvenation. So I see patient after patient after patient coming in with the exact same desire. And that is to look as young as they feel. And the reason for this is because the way we feel about the way we look doesn't change, right? Think about this for a second. You watching this, regardless of your age, probably feel very young on the inside, right? And I think I've mentioned before, most of us feel like we're in our 30s, even when we're in our 50s, even when we're in our 60s, even when we're in our 70s. 30 seems to be the sweet spot psychologically for where we exist. Time goes on. By the time we get into our late 40s, early 50s, we look in the mirror, a photo is taken, all of a sudden we're like, whoa, something has really changed. We're now starting to look old. And the reason for that is there's some hormonal changes that are happening in that period of time, late 40s, early 50s, that seem to be like a switch, an on switch that introduces the aging changes to our face that we've never had before. But our minds don't catch up, our minds don't accept. And what I found is you could be 70 or even 80, and if you are healthy and you're vibrant, you still desire to look as young as you feel. So that's the foundational desire. We know that the anatomic changes are related to a change at the level of the fascia, the deep fascia that basically holds the face up like a girdle, that starts to open up and elongate. There's an elongation process that's happening at the level of the fascia that starts to affect the corners of the brow, the mid-face, the jawline, and the neck. And there's a good reason for that because this entire fascial envelope attaches to the bone up here at the skull and then attaches to the bone down here at the clavicle. So as the elongation process happens, you start to see a downward drift of the face, sort of a down and in directionality of the aging changes of the face. So you start to see nasolabial folds get deeper, the corners of the brow causing hooding around the eyes. You start to see the jowls start to hang over the jawline, and you start to see the neck forming sagging or banding or looseness or turkey waddle, whatever you want to call it. But those are the things that are happening. So your desire when you come to see somebody like me, why you're most likely watching this video in the first place, your desire is to go back to the point you were before that started happening. But you don't want to look weird. You don't want to look like a different person. You don't want to look like, you've had facelift done or surgery done. You don't want to scream plastic surgery. You simply want a subtle, beautiful, sophisticated, natural looking outcome that goes below the radar everywhere you go. But if you choose to tell people, they probably wouldn't believe it because you look so normal and natural, and we've all been so conditioned to thinking plastic surgery and facelifts leave people looking weird and unusual. So when people realize that you can look normal, it's shocking to them because we're still not at that point where that's the norm. That happens to be the norm in our practice. That happens to be why we draw patients from all over the world to come see me for these type of procedures, because I've made a commitment very early in my practice to deliver those type of results, those type of ideals, and that's been our modus operandi or MO, and we haven't deviated from that. The other component is you want durability. I've learned this along the way that it's great to look natural, it's great to treat the problems, etc. But if the results don't last, you're gonna be a little frustrated. I'm gonna be a little frustrated. We do all this work. You want the person just to live peacefully and happily for 10 plus years, 15 years after a procedure like that, not even have to think about the aging process. Traditional facelift. So I'm going to compare and contrast some of the issues with the traditional approach. This is what it is. Incision that's made, along the hairline, behind the ear. Skin is lifted. The smaz, which is that fascia layer, over this part of the cheek. You get below it, you pull it towards the ears, remove a little excess skin, call it a day. That's a traditional facelift. Problem is, the vector is horizontal. This is how we've all been trained. Every textbook you ever open up describes a facelift the way I just described it. It's a horizontally oriented procedure. Don't ask me why, because you know very well when you stand in the mirror, you're going up. You're putting your fingers here and you're going upwards. That's the anti-aging vector, but yet facelifts pull you sideways. Also, the traditional approach lifts the fascia, gets underneath the fascia a few centimeters, from the point of the ear down to about here. Now, there's an important point here. There is a boundary, and that's a part of the smaz called the immobile smaz, which is here, means it doesn't move. It's fixated on top of the parotid gland. The fascia is adherent. And then there's the mobile smaz, the point of the smaz where things move. The part where it doesn't move doesn't really age. I mean, that part is like, it's fixed to some dense fascia over here. It doesn't really age. So lifting in traditional facelift, lifting that part of the fascia only doesn't get to the meat of the problem. It doesn't get to that part of the face that's actually been descending. So a lot of facelifts pull the face sideways and don't even get to the real depth of the face where things actually are, the action is happening, or the mobile segment of the smaz. So when you do it like that, what you end up seeing is improvement, but not significant improvement. You see durability, but not a lot of durability. And you see a face has been sort of tightened or flattened and pulled sideways. And that's not a good look, right? So let's talk about some of the trends that we'd like to see develop more in the facial rejuvenation landscape. Number one, the action is at the mobile section of the smaz, meaning your surgery should be beyond that area. So techniques that do that are the deep plane approach. I'm going to talk about that in a moment. The smazectomy, and even this purse string style lift where suture is brought up, but it's including the mobile portion of the smaz. So whenever you get to the mobile part of the smaz, you're going to be able to move the face significantly, and you're going to be able to get better durability because you're actually getting to the heart of the problem, and that improves. So a procedure that includes the mobile versus non-mobile, that's really important. And I just named 3 techniques that you should be looking for. Deep plane, there's some smaz techniques that do get into the mobile section of the smaz, and the purse string. So keep those 3 in mind. Deep plane, the reason why I like the deep plane, why I incorporated the deep plane into my vertical restore technique, is because one of the things that it does beautifully is it releases the ligaments of the zygomatic region, the mandibular region, and even down into the neck. Once that is all released, you get a significant more movement than you would if you left those ligaments in place. Once you release it, the face is like free to move, which means that there's a lot more movement and a lot more opportunity to rejuvenate the face once you're able to get it to move freely, as opposed to being fixated down into this area. So that's a really important thing. And we're seeing more and more surgeons adapt and elevate their game to performing deep plane approaches, which I think has a lot of value. Now keep in mind, deep planes have been around since the 80s. The challenge has always been surgeons don't want to go into the deep plane because it's a lot more technical, if you will. It's a more challenging operation. And if you're not doing this operation as a basic, day-to-day part of your practice, it might not feel worthwhile to expand into this next level of surgery. But it's always been known from the get-go that deep plane surgeons who are doing facial rejuvenations got better, longer lasting results, and things looked more natural, because instead of feeling this tension across the face as you're pulling against a fixed structure, instead you're getting a more relaxed, elevated look. Now, deep planes, generally speaking, my general beef with the traditional deep plane is that it's still more or less horizontally based. I like a more vertically orientation, but that's the big difference between the vertical restore and the traditional deep plane. But trust me, the deep plane is way better than a traditional facelift technique for the reasons we just mentioned. So in summary, the goals are lift the face in a vertical orientation, get to the mobile smaz. That's the way you're going to ensure the more natural, significant improvement and without looking like you've had anything done. Because remember, when there's not tension on the incisions as well as not tension across the face, you're going to get beautiful looking scars and you're going to get an all around very natural looking outcome. Now, aside from the deep plane being more or less horizontal, the purse string approach, or another term for that is the max facelift, that's more vertical. I believe the lateral smazectomy technique, which is another great technique that doesn't have quite all the advantages of a deep plane, but it also does have a more vertical orientation and does create a very natural outcome and is very safe to perform. The lateral smazectomy has a more vertically oriented type of a direction, which is really nice to see. The overall outcomes are very natural. So combining those is basically what I've done with the vertical restorer, but those are the things that you need to keep in mind and look for when you're evaluating your opportunity to have a facelift, because the last thing you want is to end up looking like you've had work done, and also to have a procedure that doesn't give you durability and longevity, which is very frustrating. But you have the tools now, you have the vision, and if you're a surgeon or a young surgeon watching this, I hope this inspires you to consider this direction as a way of taking our facial rejuvenation practices to the next level. I absolutely strongly believe that these are the key components. And if you want information about trends that I don't like, things that I don't like in facelift surgery, we have a whole nother video on that, so look for that as well. But until then, guys, I hope this gave you some insight and some inspiration on things that you should be looking for when searching for your procedure. If you haven't already, hit subscribe, like, and share so we get more and more people aware of these type of things. And until next time, Dr. Karam.